Hi everyone, I am Dr. Anurag Jena, Associate Professor at Department of Gastroenterology, IMS Some Hospital, Bhubaneshwar. In general, flares are caused by various causes. Patients with IBD who have flares do have lactose intolerance. The milk carbohydrate, that is the lactose, causes bloating, diarrhea and cramps. Although lactose is not the exact cause of the flare of the disease, but patients with active disease are advised to cut down the lactose or stop the lactose. Rather, fermented dairy products like cheese and yogurt and dahi are very helpful in such flares. Trial elimination of lactose is beneficial. Some patients might be lactose intolerant by routine, and those patients will not tolerate milk even in phases of remission. India is suffering from malnutrition as well. Absolute stopping of milk could be troublesome also. Hence, calcium and vitamin D monitoring as well as supplementation, if milk is absolutely stopped, is very essential. Fibers are always not very bad. It depends on the type of fiber and the type of disease. If the patient is on soluble or insoluble fibers, whether the patient has active disease or in remission. Usually patients with flare disease are advised to take low fiber diet, low residue diet, and patient with soft texture diet. This is usually beneficial because it reduces the intestinal irritation. Patients with remission can take soluble fibers, mainly oats and bananas. Patients with strictures are strictly prohibited to have, you have to avoid the insoluble fibers, mainly the bran, the raw vegetables. Patients with stricturing disease are advised that the diet should be cooked, peeled, mashed, and more importantly, well chewed. A dedicated dietitian is very important to prescribe the type of fiber and the amount of fiber in your disease depending upon your disease activity. A well-planned plant-based diet is beneficial in patients with IBD, especially those in which the disease activity is in remission. As I said, more importantly is that the diet should be cooked, it should be soft textured and well blended, and the diet should be chewed well. Plant-based diet have anti-inflammatory properties, they are good in fibers and have antioxidant property as well. During flares, the dietary plant fibers should be reduced because these fibers might be causing some trouble in the gut mucosa leading to irritation. Patients should be monitored for B12 deficiency, iron deficiency, and should be inquired about their protein intake, especially in disease when it is in active stage. Animal proteins, animal meat like red meat, processed meat have been associated with disease flares, especially in ulcerative colitis. Hence, plant-based diets are in general beneficial in such patients. If you look into the American guidelines, Mediterranean diet, a diet rich in fresh fruits, vegetables, monounsaturated fatty acids, complex carbohydrates, lean proteins, and diet low in ultra-processed food, salt and sugar are beneficial. A dietitian is essential to guide you in this dietary advices.